Hey guys, this is another requested video for the students at PSI Professional Skill Institute. Those in their nursing program, the first quarter. This video is about the total body assessment, the physical assessment, head to toe assessment, and it's requested by the teacher for me to upload to my YouTube channel so that the students can access that. And I give kudos as usual to Miss P, Miss Pat, and also Miss Andrea for these videos. Thanks. I also want to acknowledge Miss Gail, a wonderful teacher as well. Thanks. Yeah, the video started with the parallel, making sure that the pupils are equal reactive to light, and also accommodation. But prior to that, that was introduction to the procedure. I know there was hand washing, and there was a provision of privacy, and there was physical assessment, just watching the patient to see if there's any abnormality. So I just wanted to add this before the video starts. Thanks.
Around, they're reactive to light bilaterally from 4 to 3, okay? Now we're gonna do accommodation, that's different, that's the A part of it. So if you can follow my finger.
Can you stand on the other side?
Yeah, sorry. If you can follow my finger in, can you see our eyes are crossing there? That's accommodation.
If she had glasses on, you would ask her to take the glasses off. Inspect shoulders for the skin breakdown.
Okay, so we're just gonna take a look, you can pretend with this. Skin is intact, I don't see any lesions, I don't see any rashes.
Have the patient lay back in the bed. So it's for JVD.
Okay. So she's at a 45-degree angle, which is where you want her to be, right? So can you turn your head away from me? There you go, now you're gonna look right here. I don't see anything bounding or bouncing, right? Now can you look the other way? You can come over the other side and take a look. Nothing there, so no JVD noted.
Chest, cardiac and respiratory, assess skin color.
Okay, can you stand up for me? This isn't a aerobic workout. So skin color is appropriate for ethnicity. It's warm, it's dry, turgor's good.
Intact, no skin
Intact,
breakdown.
okay?
Verbalized respiratory rate and respiratory pattern.
So again, you don't have to say, I'm gonna evaluate your respiratory pattern. The interactions that you've had with her, did she seem short of breath when she was answering questions? No. Is she labored? Is she struggling? No. So you can just say respiration rate is regular and it's not labored.
Expansion.
Okay. If you can stand up, back to me. So basically, you're going to take middle finger right at the point of the scapula. Your picture's a little off.
Oh, is that
Bummer. Okay, so right there, thumbs meet in the middle of the spine. Can you take a big breath for me? Okay, do you see how both hands kind of moved away? Okay, so the chest expansion was symmetrical. Both hands moved the same amount. If only one hand moved, then that would mean she's got some kind of a lung problem.
Assess for cough.
Okay, again, you don't have to say anything. You're just gonna say no cough noted.
No sputum.
No cough, no sputum.
Pulse ox.
So we're just going to say that the pulse ox is, and pick a number that's appropriate for her. Would her pulse ox be 58%?
No.
No, what would she be?
97.
96, 98, 99, yeah. So just pick a number that would be appropriate for,
Use of accessory muscles, any type of supplemental oxygen, and auscultate anterior lung sounds and verbalized breath sounds heard.
okay, so. God, I just had a brain. So accessory muscles, are you seeing her, is she using her diaphragm is she laboring? Do you see her belly coming out? Is she hunching around? Is she doing any of that stuff, like she's working hard to breathe? So no accessory muscles noted. She's on room air. And then I gotta listen. All right.
That's probably working.
What's that?
I was making sure my
Okay, so
clavicle was.
clavicle. You do slide the clavicle, start on one side or the other, take a big breath in and out. Then which direction do I go? across, right, so then do the same thing on the other side, down, then where do I go?
Down.
Down, yep, down, big breath, and that. Now, we're not gonna make you guys take all these breaths, okay? But you're just gonna say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're gonna do the back.
Verbalize breath sounds.
Oh, clear, bilaterally. So, does it always have to be clear bilaterally?
No.
You could have one sound that's skunky and one that's kunky and one that's not.
Mm-hmm.
But again, you're gonna be assessing each other, so whatever you're actually finding is what you're saying, okay? So, she's clear bilaterally.
This is where she went ahead and she skipped a couple, but that's okay, because she said, because it said to, in your handout, it says to go to the heart and identify the anatomical landmarks. But if it makes sense to you to do your lung assessment and do the back now, then that's where you were going.
Yeah,
So,
that's how I do it, but let's just follow the page.
okay, identify the anatomical location.
Okay, so she's got this beautiful shirt here. So this is the sternum, right?
Mhm.
This is the right sternal border, left sternal border. First one is A for A for aortic.
Aortic.
Okay, so aortic is going to be the second intercostal space, so that's the first, this is the second, right at the sternal border. That's where you're looking for the aortic. I said aortic, didn't I?
That's
Yeah.
I was thinking atrial, okay.
You did.
Then you're gonna go directly across the sternum, just to the other side, and you're still in the second intercostal space, right there, other side of the sternum. That's gonna be pulmonary, okay? Then you're gonna go down 3 more to the fifth intercostal space, and it's going to be, the tricuspid is right there, and if you slide along the fifth intercostal space to the mid-clavicular border, so the mid-clavicular level, mid-clavicle, straight down into that fifth intercostal space, that's gonna be your mitral.
And auscultate.
Yeah. So when you're auscultating, you're listening for murmurs, gallops, anything like that. So with some of us girls, it's easier if you lay back and put everything up out of the way. So that's one of the things when you're practicing with each other, because you're gonna be paired up. You decide who you're paired up with, but you're going to practice with each other, so you know the landmarks and what you need to do to find the other people's pulse. Some people you have to lay down, some people it's better to sit, just, kind of figure that out. Cause, we do. Then, during this point, when you find the apical, that's when we do the counting, right? So you're gonna find the apical, then it's gonna be a 2-person stethoscope. You're gonna be listening and we're gonna be listening at the same time. We're gonna put the diaphragm right on the apical spot. You guys are gonna say, start. We're gonna count. Then you guys are gonna say stop. And how long are you gonna count?
4 minutes.
60 seconds. So at the end of that 60 seconds, when you say stop, you're gonna give us a number of beats that you heard. And if it's within 4 beats of what we heard, then all is well. Okay? People freak out about that a lot. I've never seen anybody really struggle with it. I mean, you guys are nurses, you count pulses all the time.
I've had one, and I'll only say because if you're gonna count for 60 seconds, count for 60 seconds. How are you gonna count for 60 seconds? What do you need to be able to be accurate about that? Clock, second hand, watch. You watch, be prepared. If you don't follow your watch, you go, oh, that's.
Yeah, if it's not 60 seconds, that's a problem. And there's a lot of a couple of people last quarter they went 30 seconds and then doubled it. You don't do that with an apical pulse, it's gotta be the full 60 seconds.
That is a bold print. That's one of the bold print, that she mentioned, okay? And now we're gonna go back, to the posterior lung sound.
Okay. So again, 10 sites there, right? 1, 2, you're gonna say the word, take a deep breath each time. 1, 2, 3, 4, 5, 6, 8, 9, 10.
Verbalized breath sounds heard.
Lung sounds clear bilateral.
Have the patient lie on their back and turn on the side. On
Which
You
side?
can turn away from me, because we're just going to be looking at skin integrity, right? Skin integrity and back. Don't fall off the back. So skin on the back, the lower back, and the buttocks is intact. Appropriate color for ethnicity. Turgor is good. That's it, right? Okay.
Now gastrointestinal.
Okay, so, this is, no, this is like you teach your 2-year-old, right? You're gonna look before you listen, before you touch, so don't touch until the end. So you're gonna look, take the skin up, again, skin in the abdomen, appropriate for ethnicity, no lesions, turgor's good, no tenting, no piercings, no tattoos. Now, if you have a great big piercing, please note that, okay? And I think, I don't know whether it was you guys or the other ones that I told, but I did a competency once, and the patient was 8.5 months pregnant, and the baby's elbow was kind of doing this. And then they said, you know, abdomen non-distended, nothing noted, and I was like, really? That baby in there is, so be sure that you're looking at your patient. This is who you're evaluating. She's non-distended, so I looked, I don't see anything like that. Now I'm gonna listen. Start in one quad. All 4 quads. A lot of people like to go way up. Just remember that the belly button is kind of the center of the grid. So basically here and here. You don't go way up under the lungs. How long am I gonna listen to a quad before I decide that it's absent? 5 minutes. Right, so let's say that I'm listening to her and I hear, which is what you guys usually do during competency. That's usually what we hear. That is
Gets you nervous.
hyperactive.
Yeah.
Right. If you hear the occasional growl and the occasional tinkle, then that's active. If you just hear very rarely, you know, every 15 seconds or whatever, there's a good break in there, that's hypoactive, and then absent is -7, okay? So after I've listened, then I'm going to palpate. So again, all 4 quads, you're pushing in gently. Any pain there? No pain. Then I'm going to take my hand, put it flat on the belly, take a finger or two. You want to see if you hear anything. You're not likely to hear anything unless they're full of air. And then you're going to hear, it's called tympanic, okay? But if they're tympanic, they're likely going to be distended. They're going to likely have, and I guess percussion, it was dull, because I didn't.
So for the percussion, we're only doing it on one spot of the
You can do 1 or 2, yeah. You don't have to.
That's when the DM was, and describe.
This is nurse talk. So can you tell me when your bowels moved last?
yesterday.
Okay, and is that pretty normal for you?
Yes.
Okay. Let's see, do you have any inconsistencies with texture with your bowels?
Nope,
They're usually, okay. Any blood or anything like that?
Nope.
Okay, there we go. That's
Gas,
enough.
any gas.
Yes, are you passing gas?
Always.
I
ate lots of beans.
So if your patient says, no, I'm not passing gas, is that a red flag?
Yes.
Is it?
Well, depending on how long.
Not, everybody's different. So as long as you don't feel, as long as the patient's not distended and they're not feeling gas pressure, then they're fine.
That's okay.
So even if they're not passing gas, as long as they're saying, you know, I'm not uncomfortable, you're fine.
Urination.
Okay. So I see you're going to, you know, you're starting a nursing job, so but we'll assume that you only pee, you know,
Twice a day.
twice a day. But on your days off, how often do you usually urinate?
Like 4 times a day.
And do you ever notice an unusual color or odor with that?
I'm dehydrated.
Okay. Is there any bleeding or pain or cramping associated with when you void?
No.
No.
That's amount.
Oh, yeah. And how much do you pee?
Normal amount.
I love that question. Well, last time I measured.
Wow.
And then upper extremities.
Okay, so if you can sit up for me. I'm gonna look at the skin of the upper extremities, I'm gonna make sure that it's intact. It's intact, there's no tenting, no lesions, no tattoos, appropriate for ethnicity, and temperature's warm. I'm gonna look at the arms, I'm gonna look at the top of the hands especially, and I'm gonna feel. I don't see any or feel any edema, right? If you're looking for edema, you're not gonna look in the back of the arms or anything, you're gonna look basically where the bony areas are. That's where you're looking for edema. I don't see any edema. We're gonna pretend that she doesn't have beautiful fingernails. And we're gonna look at her nail beds and we're gonna say appropriate for ethnicity, we're gonna say pink, whatever you wanna say. I'm gonna squeeze a couple of fingernails on each hand. And I'm gonna look for capillary refill. So when you squeeze it, it blanches out and then the color returns. If it's a brisk capillary refill, then it's 3 seconds or less, okay? If it's sluggish, then it's more than 3 seconds. So you can say it however you wanna say it. Less than 3 seconds, more than 3 seconds, brisk, sluggish, whatever you wanna do.
Assess for numbness and tingling.
Okay, do you have any numbness or tingling in your hands? No. Okay, can you put your arms out, palms up? Okay. Your hands this way. Can you push up on my hands? Okay? Now flip your hands down. Can you push down? There you go. Can you squeeze my fingers? Squeeze as hard as you can. Okay? So I would say the arm strength is equal bilaterally, and the hand strength is equal bilaterally. Now if one arm's doing this and the other's doing that, then document that too. So if you want to mess with each other doing the competency, you can pretend to
And you were in that, you assessed the ability to move the upper extremities freely.
Right. She did all of this for me, right? So you can just say, you don't have to have her do a separate test, moves upper extremities freely,
Lower extremities.
Okay, so again, we're going to look at legs. We're going to look at hair distribution when we're looking at color. Why hair distribution on legs?
Because where there's no hair, I need poor circulation.
Correct. So that's going to verify circulation if there's hair. Okay, so you're pulling the pant legs up, both sides, because you've got 2 legs. You're looking hair distribution's appropriate, skin is intact, it's warm, turgor's good. I don't see any edema. I don't feel any edema. Can you swing your legs? Okay, legs move freely. I'm going to, let me get in your way. Okay, if you can, pull your toes to your nose. There you go. And then you're going to push down on my hands like it's a gas pedal. There you go. Okay, so plantar flexion, dorsiflexion are both strong bilaterally. They're the same on both sides. Then I'm going to look for pulses.
Nail beds, colored nail beds.
Yeah. So I would. Yeah.
I haven't had pedicure, we're pretending.
Okay. So again, big toe, basically big toe and another toe. You squeeze it. You say nail beds are pink. Capillary refill is brisk bilaterally, both sides.
And now palpate pulses.
Okay, so pedal pulses, right on the arch up here. Post-tibial, back behind the ankle. You're not likely to find it with socks on, but like she said, we're pretending. You're just gonna say they're equal bilaterally.
Numbness and tingling.
Any numbness and tingling in your feet? You're gonna also look at the bottom of the feet, at the heels specifically, to make sure there's no skin breakdown there.
And you can do all this while they're laying in bed, too,
Yeah.
if you don't wanna put down there like that.
It's complete when you do at the end of your exam.
I'm gonna put the bed down, give her the call light, although she's likely to just bound out of here. Gonna document, what else am I gonna do? Oh, hand hygiene.
Just touch my feet.
So it's not complicated, it's all pretty much common sense, and it's all.
If you like this video, you can subscribe to the channel to support me, and also give a thumbs up and share and like to this video. Thanks.